Hi, I'm Dr. Joe Lilley. For many years I had a practice in Midtown Sacramento doing myopia control and preventive work with contact lenses. I joined EYEcenter back in 2015 to help them introduce myopia control to the public and ramp up our myopia control program, which we're in full swing now with. Myopia is a lengthening of the eye from close work. When your eye looks at something up close, there are little muscles inside the eyes that squeeze and they actually elongate the eye. And particularly with youngsters, if they spend too much time doing close work up too close, this will cause that eye to grow too fast, too long, and slowly their distance vision will diminish, sometimes to the point where they can't even see the big E on the chart. Well, the lifestyle changes that we recommend are making sure that you don't read with things too close. Spend at least a couple of hours outside playing and not indoors all day long using your eyes up close. The problem with the eye elongating, it not only stretches the eye, but it stretches the retina. And this can lead to retinal detachments, the increased risk of retinal detachments, as well as the increased risk of cataracts later in life, as well as losing your vision. Well, we have a number of different ways that we do this. One is multifocal soft contact lenses, which are like a bifocal contact lens, and they're meant to stop the progression of nearsightedness. Another way is called orthokeratology. It's a night retainer contact lens that will not only stop the progression of nearsightedness, but it can also improve the vision, sometimes bringing it right back to 20/20. Now, there's a real advantage over this, because this allows youngsters or adults to go all day long with no glasses, no contact lenses, and put the lenses on at night and keep their vision from getting worse and worse. Well, the benefits of orthokeratology, I always like to say, are twofold. Number one, you wear a retainer, sort of like braces on teeth. People with braces finally get the braces off, and then they're fit with a night retainer to wear on their teeth to keep them straight long term. Well, the same thing applies to the eyes. We fit a night retainer contact lens that is worn just when they're sleeping, so that when they can pop the lenses out in the morning, they can go all day long with no glasses, no contact lenses. And then every night they put the lens back in, and it keeps their vision from worsening. So twofold, it improves the vision, and long term it keeps the eyes from getting worse and worse. Well, when you think about it, you're never too young to start to control the vision. If your vision is starting to worsen, we want to jump right on it and not let it go and get worse. If the vision, say, a child comes in with their vision just 20/40, which is just a little bit blurry out there, they could still pass a DMB test, got to be old enough, but if the vision is only 20/40, they're not in real trouble. But if it gets up to the 100 level, and then the next year goes to 200 or 300, you know that acceleration is way too fast, so you've got to get it under control, and you've got to do it at any age, regardless of how young the child is. I mean, kids as young as 6, 7, 8 can wear orthokeratology lenses, with the parents helping by putting the lenses in for them, taking them out in the morning, until the child can get proficient at it themselves. That way you're nipping it in the bud, improving the vision so the child can see during the day with no contacts, no glasses, and wear the lenses at night to help the eyes not get worse. As we've seen an increase in use of computers and digital device uses in school and at work, we're seeing an increase in myopia as well, concurrent with those devices being used. The amount of time spent looking at things up close has a direct relation on how that eye responds over time. And you put an eye up close for 12 plus hours a day, it's going to stretch the eye out of shape, and you're going to start losing some vision. So what can we do about this? Well, it's actually, in the last 30 years, it's reached epidemic proportions. Myopia is up 66% in Caucasians, almost 90% in Asians. And Latinos and African Americans are not far behind us. So looking at this demographically, The Asians are much more aggressive with orthokeratology than we are. In fact, over in Asia, they look at them as, they call them OK lenses, ortho-K lenses. As soon as myopia or nearsightedness is detected, the child is fit with those, and they're worn 24/7, not just as night retainers as we wear them over in this country. Very, very aggressive for a good reason.